Julianne Murphy here on a very rainy day for day 10 of my video miniseries, 30 Days of Expat Living in Costa Rica. This is part of my LaPuraVidaCostaRica.com expat living blog, and also sponsored by our company, South Pacific Costa Rica Real Estate. Today we're going to talk about healthcare in Costa Rica, both public and private. This was requested by somebody on Gringo Expats in Costa Rica Facebook page, so I'm responding to that request. I'm going to talk more about healthcare itself and some of the costs related to that, with or with insurance, and on another day I'll talk about hospitals. Essentially, some of this will be intertwined, just so you know. Essentially, for many expats, when they come, they're very drawn to Costa Rica's public healthcare system, which is called Caja, C-A-J-A, Caja de Seguro Social, which is similar in the States, since that's where I'm from, to our Social Security public system, which most people don't use unless they're indigent or don't have the money for private health insurance, which of course Obamacare attempted to reverse. The point is that when you come here, you are not eligible for Caja when you move here as an expat until you have your legal residency. Once you do have your legal residency, which I'll talk about in another longer video, you can watch my Facebook page for that. So once you have your legal residency, you can then apply for Caja. It's a process. It doesn't take that long to get accepted once you have your residency, maybe a month or two, depending. You need to go 2 or 3 times to get signed up. To give you an example of what Caja costs, I am married to a Costa Rican national, so familiar Tico, which makes me now a Tica, generally, even though I'm also a gringa. For the two of us to be covered under Caja, which is full healthcare, it is socialized medicine, to be clear, we pay 33,000 colones a month. That includes all doctor visits, all public health care in terms of public hospitals, any emergencies, etc. That, with the equivalent of the colone to the US dollar, is $58 a month. Amazing, right? Now, keep in mind this is socialized health care. So if we have something that we need to go to the clinic for, you show up at the clinic in your little area, you take a number, and you wait in line for the doctor. That can be an hour, that can be 4 hours, that can be all day. It depends. Most of the time, if you show up that day, they'll see you, but they do close generally earlier. But when you go to the doctor, you don't owe anything, zero. And when you show up at a public hospital for an emergency, especially if it's an emergency, they see you right away. If it's something that's not life-threatening, then you may wait for some time, just like in Europe or any other socialized medicine system, and you don't pay for anything. Now, what happens when you come here and as an expat, you don't have Caja, maybe you're on a tourist visa in and out for some time until you get your residency visa, or you never get it, which many expats never do. I do have an example. A friend of ours had a burst appendix not too long ago, a couple of months ago, and ended up going to the public hospital nearby, was admitted, obviously with a burst appendix, they weren't going to turn him away, and then ended up with the surgery spending 2 full weeks in the hospital before he was released. They have no local insurance. They're not eligible for Caja, so they don't have that. But the public system agreed to take care of him, which they will do. And the fee for that 2 weeks in the hospital, including the surgery for a burst appendix, was $14,000 US. Now, that's a hell of a deal compared, frankly, to anywhere else, basically in the US or Canada or Europe. It'll cost you a lot more. Europe different because some of those are socialist medicine, but that's just an example for you. If you choose, and I'm going to talk about private hospitals another day, there are private health carriers here, private health insurance carriers here. If you choose to go that route, instead of waiting to be eligible for Caja, you're going to pay for it. I have currently a private insurance plan through a group called Morgan White. They're actually based out of Florida. That covers me here with private hospitals and private doctors outside the Caja system. The quality of care tends to be more sophisticated, maybe better trained doctors. I'm not going to get into that now, but that's a choice you have as an expat when you come. For my private insurance, at my age, late 40s, I pay $2,000 a year. That's with a $2,000 deductible for out-of-pocket and or hospital stays. And that makes me eligible to go to the 2 top hospitals in the nation, SEMA, which is a private hospital, and also Clinica Biblica. So that's just some examples for you. I'll talk more about hospitals another day. and probably also more, definitely more about hospitals on another day. So, live in La Pura Vida. Oh, and I'll talk about dental care as well. That's another good one people ask a lot about, and I do have some personal experience as well as some other examples. So for more on these little glimpses of expat living and my own experience after having lived here 2.5 years and 10 years almost now in Central America, go to lapuravidacostarica.com. And for those of you that are interested along the South Pacific coast, our real estate company, Costa Rica Pacific Real Estate.com. All right, thanks so much. Have a great day.